Many of us have operated in a space where showing weakness or lack of capacity or technical expertise can be frowned upon. We're out there to win grants, to win proposals, to show our value in bringing even greater resources to our own organizations. I've been part of it, and I know that's the unfortunate premise of how much of our work operates. What I saw out there, however, was a process that turned this paradigm on its head. As others have mentioned, this began as a weekly gathering to share data and ideas for programmatic and operational responses to COVID-19 in relation to community health workers. This structure was hosted through the Community Health Impact Coalition, though countless other key players fed in. I took part in those weekly meetings along with many of you that engaged dozens of actors, essentially building out in real time the protocols needed to help protect, support, supervise, capacitate, and fundamentally quantify the number of CHWs on the front lines of the COVID-19 pandemic. How can we really work to protect CHWs? Who to leverage for supply chains? Who to leverage for, who has relationships with all the ministries of health to ensure smooth importation into these different countries? Who to leverage for transport? How to move the product from points of manufacture to each of the countries, and then from the capitals out to the counties and provinces, and ultimately into the hands of CHWs working tirelessly out there at the last mile. The answer was countless organizations, people, entities, and ultimately donors stepped in to make this work. The dysfunction so often rampant in emergency response was replaced by a collective action relatively unknown in this space. Many of us recognized that the need was far greater than any one of us could provide, and that there were others who could reliably and adequately fill the roles that our own organizations could not. And that's not a small feat. There was no time not to respond. That sense of commitment, vulnerability, and action were the hallmarks of this incredible effort.